So I just did big circles. Now I'm going to lean in just a little bit more, and I'm going right across the navel. And I'm trying to slide here, but it feels like we hit bumpy roads.
Yeah,
we hit. What did we hit? Bumpers with speed stops. What do they call those? Speed bumps.
Yeah.
It's like a speed bump. Like I'm trying to go through, and it's like.
Yeah, that's what it feels like on the inside. It's angry.
Now here's the thing: is it think rectus abdominis, lateral obliques? Is it muscle, or are you ready? Can people have referred pain from abdominal muscles?
Yes.
And when I say abdominal muscles, I mean large intestine, small intestine, smooth muscle tissue.
Oh, absolutely. We've discussed this.
And that's where like there's a lack in my knowledge base that I'm completely willing to bring students on my journey. The bottom line is I could help people.
Yeah.
When I worked with women who were like, dude, what the fuck did you do? My menstrual cramps, oh my God, it usually feels like velociraptors are trying to chew their way out of my body. Yeah. That was the easiest cycle I've ever had. I could build a practice just doing this for women with menstrual cramps.
Or people with digestive issues, because that's what this is. That is so weird. So yeah, no, that's great. So when you're on my left side, it was pushing down and like kind of making that sensation of whenever it hurts and I need to have like, release bowels or whatever. But then whenever you're on this side, it's more of that indigestion that I feel. It's weird. So one is one way, one's the other way. Both of which I suffer from with my celiacs. I'm being good. Oh, yeah. Jeez.
Right there?
Uh-huh.
So I went up to the speed bump.
Uh-huh.
It just hung out on it. My hand is just kind of wrapped around it. My legs are going to sleep, so I'm just going to change my position a little bit. It'll also be, since I'm a little lower, it'll probably be a little less pressure.
Yeah. Which is fine by me.
How's that right there?
That's good. Ugh. It's like shooting pain on the low back now.
Where? Middle?
No.
So is it sacrum?
Yeah.
Okay. So when she says, I have referred pain, it's in my sacrum, clients aren't going to know to say sacrum.
Yeah.
I'm like, that spot above your tailbone? They're like, yeah. Like right in your low back? Yeah.
Yeah. Yeah.
So what the trigger point reference manuals will say is, psoas. It'll show a big band of pain across the sacrum.
Mm-hmm.
Now, here's what the pain science community will say. I'm not touching your psoas. I'm stretching your skin.
Yeah, but with this, yeah.
I'm with you, and I even joke with a client about it because I'll do. I've worked with him a long time in his neck, and I'll have an elbow, a pointy elbow. We build up to that. I have a pointy elbow in his suboccipitals, and I like to the back, and he's like, ooh, and I'm like up, and he's like, ooh, right there, and I'm like, Nathan, I just want you to know that all I do is stretch skin, and he'll laugh because it's this ongoing. He's like, yeah, sure, whatever. He's like, as long as you keep doing what the fuck you're doing, I don't care how you explain it.
Exactly.
We want more effective treatment.
This is awful, but I know it'll be better in a
Too
minute.
much?
No.
Okay.
It's getting.
So
It's finally starting to like.
if my hand gets tired, one, I got a towel I can wipe I'm going to reinforce with the other hand because I'm trying to take pressure off my left hand.
Yeah.
There we go. Is that too much?
No.
Okay.
But I can tell that I'm like.
Sure. So,
fighting you.
Do you need less pressure?
Maybe.
Okay. If I back off just a little bit, is that better?
Yes.
Okay. So here's what I want you to do. In through the nose, out through the mouth. Ah.